Dear students, today we are discussing the May 2021 question answer key of Kuhs Community Paper 1. May 2021. May 2021. May 2021. May 2021. So the first question is a 10 marker essay. Define IMR, infant mortality rate. What are the factors influencing the infant mortality rate in India? What are the measures taken to reduce the infant mortality in India? The definition infant mortality rate is defined as the ratio of infants' deaths registered in a given year to the total number of live births registered in the same year. So the infant deaths registered in a given year to the live births registered in. Factors affecting biological factors like birth weight, age of the mother, birth order, birth spacing, multiple births, family size, high fertility, economic factors, cultures of breastfeeding, religion and caste, early marriages, sex of the child, quality of mothering, maternal education, quality of the health care, broken families, ill legitimacy, brutal habits and customs, indigenous dye, bad environmental sanitation, preventive measures, perinatal nutrition, prenatal nutrition, prevention of the infection, breastfeeding, growth monitoring, family planning, sanitation, provision of primary health care, socio-economic development and education of the females. Next question is a 5-marker problem. If primary school teacher comes with a student complaining of itching of hands and a history of similar complaints among few other students in her school, as a medical officer, what will you do to that student and what advice you give to the teacher? It is a diagnosis of scabies, treatment of scabies for student. First, good scrub with soap and hot water. Application of benzoate below chin, whole body. Repeat the same treatment after 12 hours. Bath for 12 hours. Wash all clothes and bed sheets. Advice to teacher: all family members of the student should be given the same treatment simultaneously. Similar treatment should be given to other infected students and their household contacts. All the unaffected classmates of the affected student should be given the same treatment. Benzoate. Benzoate. The third question in this question paper, as a medical officer, what measures will you take to reduce the anemia among pregnant women in your area? There is an action plan or action taken at individual level or family level, community. Antenatal hemoglobin testing, IFA tablets, and folic 180 days during antenatal period, prophylaxis 100 mg iron and 500 microgram folic acid, high risk approach in anemic, 2 tablets IFA per day or parental iron, nutritional education, enriched diet, meat, poultry, fish, green leafy vegetables, legumes, nuts. Then Anganwadi supplementary nutrition, other measures, control of parasites like hookworm. Then next question is the short answer question. What is demographic cycle 4 mark? So demographic cycle, first stage is a high stationary, that is high birth and death rate. Second stage is early expanding. High birth rate, death rate begins to decline. Third stage, late expanding. Birth rate tended to fall. Death rate declines further. India is best example. Third stage. Fourth stage, low stationary. Low birth and death rate. Fifth stage, declining. Birth rate lower than death rate. Then fifth question, short answer, incidence and prevalence of a disease. Incidence is the number of new cases occurring in a defined population during a specified period. Use of incidence rate Prevalence means all current cases, old and new, existing in a defined population. Types of prevalence: point and period prevalence, relationship between incidence and prevalence, uses of the prevalence. And what is specificity and sensitivity of a screening test? The criteria of screening test, or the validity or the accuracy. Validity or accuracy is sensitivity and specificity. Sensitivity, ability of a test to identify currently all those who have the disease. Specificity, ability of the test to identify currently who do not have the disease. Then cultural factor in health and disease. Concept of etiology can require supernatural causes, physical causes like impure blood, environment and disposal of human excreta, disposal of waste, water supply, housing, food habits, mother and child health, good and bad customs, personal hygiene, oral hygiene, bathing, shaving, wearing shoes, sex and marriage. Then what is epidemiological triad? It is interaction and interdependence of age, host and environment and time in causation of the disease. The next segment is the differentiate between. First question is relative risk and attributable risk. Relative risk means an explanation of what is RR, relative risk. Measure of risk in cohort studies, relative risk. Incidence among exposed by incidence among non-exposed is relative risk. It is used in public health. Attributable, an explanation of what is attributable, measure of risk in cohort study. It is incidence among exposed by incidence among. It is the incidence among exposed minus incidence among non-exposed by incidence among exposed. It is used also in public health. Differentiate between slow and rapid sand filters. Slow sand filter occupies large area, rate of filtration 2 to 3 mgad, effective size of sand 0.2 to 0.3 millimeter. Preliminary treatment: plain sedimentation, washing by scraping sand bed, loss of head allowed. For removal of turbidity is good, removal of color is fair, removal of bacteria, operation less skill. Rapid sand filter occupies very little space, rate of filtration 200 mgad, effective size of sand 0.4 to 0.7 millimeter, chemical coagulation and sediment by backwashing 6 to 8 feet good, removal of color good, removal of bacteria 98 to 99%, highly skilled. Then eugenics versus euthenics. Eugenics means science which aim to improve the genetic environment of human population. Negative eugenics, positive eugenics. Euthenics, improved genotypes with the suitable environment needed for improvement of the human race. Then substantiate your answer with reasons. Sanitary latrine to prevent fecal-oral transmission of diseases. Yes, it is true because sanitary latrine provides sanitation barrier. Iodization of salt helps to reduce iodine deficiency disorders among people living in goiter endemic areas of the country. List the following uses of epidemiology to study the rise and fall of disease in the population. There will be community diagnosis, planning and evaluation, syndrome identification, completing the natural history of disease, evaluation of the individual at risk, searching for cause and the risk factor. The methods of solid waste disposal. First is dumping, controlled or tipping or sanitary landfilling, incineration, composting, manure pits, then burial. Methods of nutrition assessment: clinical examination, anthropometry, biochemical evaluation, functional assessment, assessment of dietary intake, vital and health statistics, ecological studies. What are the dimensions of health? Physical dimension, mental dimension, social dimension, spiritual dimension, emotional dimension, vocational dimension. Methods of sampling: simple random sampling, stratified random sampling, systemic random sampling, cluster sampling, then cluster sampling. Okay. Next question paper we will discuss in the next video. Thank you. Have a nice day.